Allaha wa malaikatahu yusalluna ala nabi. Ya ayyuhallazina amanu sallu alayhi wa sallimu taslima. Allahumma salli ala Muhammad wa ala ali Muhammad wa barik wa sallam. So today's health clinic is about skin conditions, and we will talk about the most common skin conditions in today's show. If you have any question which you want to ask us, you can ring us on our studio line, for which the number is 01902 972 150. If you want to ask a question via WhatsApp text, our number is 07 440 420 432. We are currently unable to take any calls on WhatsApp. So if you are calling from outside UK, you need to ring as 0044 1902 972 150. Today, our program is going to be mainly in English, where we are going to talk about the most common skin conditions which we come across. It is for those parents whose children suffer with it, which is the condition called eczema, and it is for those young people who quite often suffer with this problem, which is going to be acne. If time will permit, we perhaps will talk about psoriasis in brief details today. And for this show, I have invited an extremely prestigious guest to our studio. He is a local GP with special interest in dermatology and has got an extensive experience of over 15 years to work in primary and specialist care dermatology, uh, where he does a specialist clinic in local hospital. I would like to introduce my guest today, who is with us, Dr. Shahid Rafiq. Uh, Assalamu alaikum, Dr. Saab.
Thank you for inviting this show, and I appreciate you invited all my local colleagues and GPs and hospital consultant, and to awareness of different medical conditions, and we talk about today about our common conditions, eczema and as well acne, and hopefully in next couple of shows we discuss pigmentation problem, the hair loss, which is another common condition we come across in Asian community locally and globally.
Excellent. Thank you very much, sir, for your time. We really appreciate that, and I think it would be of interest to our wider audience to know about these conditions. So we will start first thing, which is eczema, which is very common presentation, especially in young children. And I heard that there is a saying that about 1 in 3 children in Britain at some stage suffer with this skin condition, eczema. So can you just start with very basics for my listeners? What is eczema and what happens in it?
Eczema is the most common skin inflammatory skin disorders or condition we come across in adult life as well in children, and it does affect about 15 to 30% of children, and mostly in 60% in the first year of life, and some are 85% in the before age of 5, and 1 in 20 children have one severe disease. How we diagnose eczema, there's a diagnostic criteria we use sometimes, but I think mostly if you have a itchy condition, then you have a underage eczema itchy condition under the age of 2, then and also mostly on the creases, um, can be on the back of knees, or also on the in front of elbows. But in the children, sometimes it can comes on the forehead and cheeks. So when especially in babies, although traditionally people say, oh, it eczema just on the back of knees and elbows, but it can be in the outer limbs in the children, and it is also associated with lack of sleep, itchiness. So along with the history of um, some people have history of asthma, wheeziness in children, or you have a family history of eczema, which can be one of the diagnostic criteria. We think maybe if you take if a patient come to you in the practice or in hospital, we ask these questions to come to a diagnosis.
Thank you. So, a very important message in terms of that this is one of those red skin rashes which doesn't look good. Mainly, they are classed as dry skin condition, I guess, and that is uh, because we all want a picture perfect baby, and whenever that rash comes, that doesn't look nice. So the parents, rightly so, get very uh, worried about it, and that is the time when they come and see you. So what would be, other than that there could be family history, what other things can lead to eczema or can flare up eczema?
Um, we seen if you have another figures we if you have children out of 100 children 100% or 60% go into remissions by the age when it adolescence, but 40% carry eczema. um, Risk factors can be genetics and also environmental. Genetics, if you have family history of eczema, uh, and if one parents have eczema, then 25% chances have eczema in any time in the life. If you have two parents both eczema, and then you have 6 times more chances of eczema. Then along with, they have a lot of environmental factors coming into that, which include irritants, okay, and also although diet has no role, and sometimes um, um, irritants like if you have a soap, if you have a chlorine in same pool, and it's wool clothing, uh, and also excessive heat, sweating, and skin infections, stress, airborne allergens, food allergy, and also some pregnancies, animal, damp cold. And these can be trigger factors in eczema.
So you have obviously touched on very, very common worries or questions which parents would have, that what would make the eczema worse. So if we go through them one by one, which you described them as irritants. So you said that there is something to do with food. This is a very common question people ask. Is that the breast milk? Is that the cow's milk? Is that something to do with milk? So can you sort of elaborate a bit more on food, and then we go on the other irritants?
Although, if we have a patient, if a children has eczema, out of 30% if you do the testing, 30% have problem with food allergy, but they don't always cause a aggravate eczema. There's a myth there, okay, if food is big, that we if you have a eczema, then it may be food related, but there's only 30% people have. So most common is we come across is a milk, and egg. They can be allergic to, and we discuss more how you tackle with when you have a treatment. Second is airborne, which is more common is house dust mite. You have a grass, and then you have animal, just like cat and dogs and pets at home. And third is allergic contact. We have some preservative in the creams. Even if some children have eczema, you may find some preservative is causing irritation. Sometimes some fragrances, okay, people use on them. And also, these things are more common when you have very severe and moderate eczema, and in that case, we have to explore these issues. Mostly, we ask our patients go home and have a diary of the what they think the allergens are, and come back. Then we act accordingly if they need any testing to be done, which can be done in the mostly in the secondary care in hospital setting, and also in community GP settings, some places.
So thank you. So obviously, many parents will come and ask for this allergy tested, and as far as I knew, most of my primary care colleagues would say uh, to try different things, and as you said, make a diary, try to shorten the list of what they feel could cause problems. So how common is it is for the eczema and allergy testing?
Uh, Common is we are you asking for the allergy test? How common it is?
So yeah, I'm just trying to say, if shall we send everybody who comes with a eczema for an allergy testing, or shall we just sort of
I think we patient who has not responded to treatment, patient who has a very severe eczema, and these kind of patient we come across where need more testing is needed.
Okay, thank you. And obviously, we will come to the sort of severity of eczema in a minute. Before we go on there, if I can just ask, people ask very commonly again, uh, bubble bath or any soaps, do they have any direct relationship with the flare up of eczema or causing eczema?
It does. They have chemicals. It does flare up eczema. That's why we advise all the parents, even adults, to avoid any soap opera bath or any soap to wash the skin. Even do not use the normal water to wash the skin. It makes the skin very dry. So instead of they can use a emollient, which we can discuss in our treatment section.
So why does this skin become so dry? What is an underlying mechanism for this eczema?
There's a barrier dysfunction which can cause eczema, and that's why the barrier is broken down where the skin become very dry. Okay.
Right. Okay. So coming back to the severity of eczema, can you just sort of tell us, because in my personal experience, each parent would come in with the tiniest possible rash, think that is the worst eczema ever, and I can understand for their baby that is perhaps the worst eczema ever. But if you just give us a brief outline of what is are the different severity classes of eczema.
Okay. We there's a we can try, and especially talking with the children. So there's no mild, moderate, severity, depending on how extensive they are, and we have to distinguish, especially if you're going towards adult. You have when they have eczema on the face, we have think of contact dermatitis, we think of seborrheic dermatitis, or we think of psoriasis in that case. And in the children, most likely it is eczema. I think severity depending on have they got infection, have they got all body involved, okay, what part of body is involved. So it's really depend on.
Right. Uh, so there are children who will come with rashes on the face, and there will be children who will come with rashes on arms and legs. Is there a difference between having the rash on the face? Is that more severe, or is that still classed as eczema based on how much extensive spread it is?
In the children, you may see that most of children when they come to eczema, they have on the scalp, they have on the face, and they have less on the body. You have on the outer part of the body. As time goes on, they have depend on they have more on the knees, elbows, and limbs. But in spontaneous babies, you may find eczema more on the face. There are some trigger factors from there. Maybe the babies have a toy, they have saliva coming up, some lot of irritation factors, which causing the eczema, especially in babies.
So you just mentioned about saliva. So there is something called salivary dermatitis, which happens on the face. It has anything to do with eczema, or it is altogether different thing?
I think the saliva does irritate. If you have majorly, if they have a dummy, if they have a toy in the mouth, okay, and the toy was contact the house dust mite, and that's got irritated. Sometimes at times the kids have a tomato which ketchup, okay, that's also irritant. So sometimes you think they have a irritant eczema because then they come in the food allergy.
Right. I just got this question on WhatsApp, which is I think the timely question. I just parked it for a little while. Uh, they said you mentioned about house dust mite. Can you sort of elaborate what kind of things will have house dust mite and what can we do about it?
House dust mite is one of the things we come across a lot, especially in this country. If you have and because house dust mite lies on your on the carpets and lies on your mattress, lies on your on the curtains. So there are few suggestions, and we give to the parents how you control house dust mite. So mostly we ask our parents to use ideally, in ideal world, they can replace the carpet with a wooden floor, other things. Or if not, then they use a very high power vacuum cleaner, and also use the minimum as a toys in the rooms, and there are some in the inside the curtains they can use the blinds, okay, and also now there's a certain blinds well you can wipeable, you can wipe them on a regular basis, and there's contain sealed contained bags for the mattress, and a washing of the beddings on a regular basis with a 60-degree on the washing machine, and that's mostly we ask the parents to do house dust mite. But sometimes that's why if sometimes line the walls also, even you remove everything in the room, they still have house dust mite, which is very difficult to tackle.
Thank you. And just we move through the complications of eczema in children. What type of things can go wrong with eczema?
In Asian skin, you may come across a lot of infections. Is the most infection can happen. Mostly is bacterial infection. You can have a viral infection, and you have pigmentation problems, which can be darker skin and can be lighter skin in either cases. Also, sometimes because overuse of steroids can cause problems, and now psychosocial in aspect we come across because of the especially the teenagers, they can't go out because of eczema on the face and on visible areas. So this is another aspect we deal with in our practice, where how you overcome the psychosocial aspect of this eczema within the teenagers, especially in the kids also, and bullying it happens sometimes.
Yes, and that is obviously has got its own issues because it will have more psychological and emotional impact on the health of those teenagers. Uh, if we just sort of go and touch very quickly on adult eczema before we go on break in about 8 minutes, uh, there is some good news for the parents about their children growing out of eczema as they grow old.
Yeah, I said I think in the 60% goes out of it. Okay.
60% of children.
Yeah, it
And is
goes.
there an age when they will expect?
Adolescents, but teenagers, by the they go out of, I think 40% carry on, and also out of them maybe 1 in 20 maybe carry on very serious eczema whole life. So mostly they go out of it. I think they really depend on the other factors. We found that if you start eczema at a younger age, first 3 months, they have a severity is high. If they're not family history of eczema, for example, if you have a asthma, you have a hay fever, then tend to have more severity. And if they have so these are few factors which can sometimes eczema maybe carry on in adult life also.
Okay, so does the eczema affect adults in the same way as it affects in children, or it reduces in severity or stays the same?
It's the same, I think, no, but it does affect more in different parts of the body, and also can be severe, and also it can lack sleep, itching, and also it can be troublesome in kids because there are more recurrent flare-ups. But fortunately, over the last few years, we have more treatments coming up in the eczema management of the adults. We have phototherapy, and also we have biologics medications available.
So we will come to the treatment in a second. And if I just sort of touch on a little bit more information about the adult eczema. Is there any difference in the complications of adult eczema as compared to the children? You mentioned infection is the most common one in children. Is that the same scenario for the adults?
It really depends on the cause. Sometimes eczema can, you could think eczema maybe seborrheic eczema, depending on, also could be a contact dermatitis. Another one which is very common we come across, especially if you have some people have eczema on the face, and might be possibility you think seborrheic eczema normally affect the behind the ears, on the eyelids, also on the side of the nose, and also upper part of the chest. But sometimes psoriasis presents similar picture. Sometimes the treatment is same, sometimes difficult. When psoriasis, they have different part of bodies are affected, nails are affected. And if someone has eczema on the recurrent eczema on the face, in that case, we have to think about allergy testing to be done. Sometimes allergic to chemicals in the makeup, especially ladies, or fragrances. Or sometimes we have hand eczema, which also is very common occupational hazard. Some people have a hand eczema. You have to think about whether need further testing, allergy test to be done for the contact dermatitis. With the hand eczema, we have to think about if you have a on palms of hand in the feet's hand, that could be a psoriasis. If you have both sides of the hands, it could be a allergic. So 30% of people who work in care or medical profession, or they have a problem hand eczema, for which allergy test to be done. And some people have work in the factories, or some they can have using chemicals, you can allergic rubber also, and some painters they can allergic paint. So they are for which these patients, if they have not come in, it's not um, getting better with the traditional treatment of steroids, emollients, then they need to be, we need to think about allergy testing. They need to go to the GP to refer to hospital setting, community setting, to have a patch test, request a patch test for routine allergens.
Sure. So I think what it comes across to me like that most of the differentials of eczema are based on taking a good history and the people who are suffering with it to provide as much information, especially if it is contact dermatitis. It perhaps will be obvious when they get in contact with that thing, it would perhaps come, and then if the contact is removed, the skin condition perhaps will improve. So it is really important for those individuals who have this kind of skin rash to observe for those things, what are the flare ups and what helps in settling it down.
Yeah, you're right. Other thing with contact dermatitis, there's different series available. For example, you have a hand eczema, you have different chemicals use hands. You have facial eczema, different for eyelids, different for for other part of body. Some rashes in the perineal area is different. So and also the different series available for different kind of rule out allergens. Another eczema which come across, especially people who have the hair, dye the hair, ladies, this chemical PDP, which is PDP, which is very in the common in the black hair dye. So you may find the patients have a eczema before hair dye. So for which another test to be done, patch test to be done in hospital setting or community setting to rule out the allergy. Then there are a lot of hair dye available without any this chemical.
Okay, so obviously people do come after for a reaction after the hair dye, which is very acute reaction. But if they have eczema, that would be more prolonged history.
Yes. What happen if you have a already eczema? Then tend to have more. You tend to have more contact dermatitis. So chances of contact dermatitis very high if you already have eczema history, eczema before. But contact dermatitis can come as it alone. You don't have to be eczema before in the past.
Okay, that's fine. So the question which is most commonly asked, and one of our listeners has asked about, what is the role of weather in eczema flare up?
Weather, okay. If you have very cold weather, doesn't help because especially when in the we have central heating on, and inside the house, okay, it's very dry. Okay, and also weather does help. If you have eczema, you may find people go outside, they can eczema. It's get better, but I think if you have a eczema with the infection, it can make more problems for you. That's why in the summer season, eczema may get better because of the sun. Okay, but I think in winter season you may find eczema, and because dampest condition make more worse. So winter is more worse for the eczema.
Right. Okay. So in adults, could it be still related with food, as we talk about children when it can be related with milk? In adults, could it be related
It
with food?
can be sometimes if you're allergic to nuts, other things. It can be still can be related to some egg. Okay, some people have allergy, but most of people grow out of egg allergy as time goes on. But it can be to nuts. It still carry on. It can be some, and also some food. For example, some food like fish, prawn, and these sort of things. It can relate to some. It can.
Okay, thank you. I think we are just now going to head to our break. We have so far in this show covered eczema both in children and adult. We talked about what are the exacerbating or triggering factors. We talk about various things which can flare it up, what kind of complications we have. I think when we will come back from break, we are going to talk about treatment of eczema, which I'm sure most people are interested in. So stay tuned with us at Ramadan Radio Wolverhampton, and we are on Facebook Live. If you have any questions for which you want to ring us, our studio number is 01902 972 150. And if you want to send your question via a text, our WhatsApp number is 07440 420 432. So we will be back shortly after a short break. Please stay tuned and we will talk about treatment of eczema. Bismillah ar-Rahman ar-Rahim. Dear listeners, welcome back. to Health Clinic with Dr. Gilani, and today we are talking about skin conditions, and we are uh, asking questions from our guest today, Dr. Shahid Rafiq, who is a GP with special interest in dermatology with an extensive experience of both primary and specialist dermatology. We have covered a lot of aspects of childhood as well as adult eczema, and he has provided us already so much valuable information. What we are going to do now is that, which is the most important part of it, how do we treat it, and we will go from children and then we will move on to the adults. So welcome back to our show, sir.
Oh,
I
thank you.
think we will just need to now go and see how we can treat eczema. I have seen parents who come to ask me a magical cure. They just want it to just disappear from their baby altogether very quickly. And that also brings some frustration for them and sometimes for the clinician. So you just tell us how you would treat eczema, how what should be the expectations and how much patient or parents will expect, and how the clinicians should react to it.
I think I divide the treatment part into the prevention of flare-ups, and second part is the medications we give to the prescribe to the children and to parents. We discussed already house dust mite, okay, which is another factor, and we also discussed touch on the white soap, bubble bath, okay, and also in winter season turn down the heating. They said if your heating is nearly 18 centigrade on the that should be okay at during winter season. If you do very high, then it causes more. It can make eczema more, sometimes irritation and cause itchiness. Okay, so other thing we avoid the wool clothing, especially in winter season. Um, then other question people ask for the swimming, whether my child can go to swimming or not. I suggest if they use they can go swimming, because the only thing with the swimming there's a chlorine there which can irritate the skin. So I advise to use some about half an hour to 1 hour before to use some emollient, which ideally in a real world should be ointment, which is more observable, can be, and they go into the pool. When they come off the pool, they use the moisturizer again, so that it can protect the skin. And also try to not to go to swimming when the child has infected eczema, for example, when they have viral or bacterial. Sometimes parents doesn't know what is a bacterial, what is infection. So if they think the skin is red, inflamed, and crusty a little bit, that it means it is infected. So that's why they need a more seek advice from the GP. Other issue is breastfeeding. There's evidence now coming up if you breastfeed the child, especially first 6 months, it delay the onset of eczema. So if you for example, if 3 months, it delay the onset. If you buy 1 year, it further delay the onset of eczema. So we suggest to parents, okay, if they have family eczema, and if they have one parent or both parents have eczema, try to breastfeed the child if possible. No, coming back to the treatment point of view, I divide into a few things. One is emollient, which is a moisturizer in our layman language. Okay, so you use emollient depending on, this come in different forms. You can have in the form of creams, in the form of ointment, lotion. Most parents like the cream because it is patient friendly. Sorry, because it is patient friendly, and ointment is sometimes greasy. Let's go on the clothing, then in case of washing. But if you don't like the cream, maybe use ointment at night time, which is more better. Okay, and also in the you, as a profession, we used to give a lot of bath oils, other things. I think there's a trend coming nowadays with the bath oil. Yeah, it's more slippery. Other things, trying to use the same emollient as GP has given to you. Use as a soap substitute instead of using as a soap. Use it as a soap during bath or shower, and use the same one afterwards. and avoid some people use water only. Try to avoid water because it makes skin more dry, and also sometimes you may find some of the emollients they have some preservatives, okay, and which can cause sometimes which can cause stingy sensation to child, especially if its skin is very inflamed, or maybe some allergies to preservatives also. You may find sometimes they use lost or they may be preservative which can cause um, irritation. And some the other questions normally ask me, okay, whether daily bathing. Yeah, you can bathing. You have to use not a bath couple of times a day, but otherwise because it's very dry. And if they want to use bath, maybe use water in less than 20 minutes. And showers, most people have showered nowadays. I think in the shower you can use same emollient, okay, and as a use as a soap substitute. So this is about the emollients. So you may find over-the-counter emollients, and you may find other ones with GP. It really depends which one suits. Okay, sometimes they have a preservative which can be irritant. So whichever suits your child, it's better. But I think advice will be the ointment is better at night time, especially if skin is very dry, or if you can do it daytime also. For the scalp, some cradle cap is very common. You may find the kids and mothers. There's use. We use.
Sorry, we just got the feedback that your voice is not as loud as people would like. Could
Okay.
you just sort of pull the mic near you? That perhaps would be helpful.
Okay. Sorry.
That is much better.
Okay.
Thank you.
Sorry.
Go on.
Okay, I think with the I can hear now better myself. Okay, and now with the carrier cap, avoid oil because it become a barrier between the creams. So old-fashioned oil should have gone off and should be using ointment or use emollient creams to help the eczema on the for the carrier cap. Then that's about the emollient, which is very important part of the first treatment. Second is a steroid cream. Again, there's a myth whether I should want to use a less stronger steroids cream, more stronger steroid creams. On the face, we try to avoid more stronger steroids, less stronger. But I think other which my colleagues also everywhere we use try to use less stronger. But I think we try to use other way around. If you use stronger steroids cream for a short period, that's better than less stronger steroid long term. Okay, so that's where I advise because parents get scared because it become thin skins, rebound effect. So normally if you want to use steroids, you can use 1 week, then reduce it 1 week after, then use twice weekly, then reduce once weekly. So reduce it slowly. If you stop all of a sudden, you may have more chance of flare up. Other question people ask about the where you put the steroids, all of the body or where it is. We asked where the inflammation, where child itching, put the steroids over there, and which one, and also have a, if your child have a flare up, then you have to use both. So what you do them, you can use either of them. You can use steroids and maybe have a gap of 20 minutes. Uh, in my practice, I ask them to use steroids first and afterwards use the emollient. And some it doesn't matter which, but I think I asked them because if you use the emollient cream, steroids come in okay on top of it. So that's one thing with the parents ask what I use first. It doesn't matter which I use first. Second thing is about the side effects. Okay, you may ask if you use a lot of steroids on the cheeks, it can cause redness. Some babies have a lot of redness, but redness will go with time. But I think try to avoid long-term steroids, especially on the face. And now, second is third is antihistamines, which is very when child have flare-ups. Okay, I know we worried we don't give this long term, but I think child has flare-up, give us steroids. Antihistamines can be sedating, especially if they're itchy at night time for a couple of weeks. Like then, no sedating one, which is can be you can buy over the counter or you get from a GP practice or hospital prescribe. You can give. Okay, so depending on. Especially give at night time because nighttime more itchy, but they are sedating one which is better at night time, and this is the treatment available. And
So the question we have is that are oils good moisturizers and do they help as good as creams prescribed by the GP?
Oils, I think they act as a barrier. Okay, so we think it's because especially olive oil, these act a barrier between skin, though the cream may not. So I try to avoid oil.
So I think that what they're trying to ask
Which
is,
oil is
instead,
that?
in place of moisturizer, can we apply oil? That's, I think, what they want to ask.
Depends which kind of oil you're using it. Okay,
So
if
is
you
there any which they can use in place of moisturizer, or better avoid?
a better avoid, okay, you can use it, but think normally, as for we know, we are advised to use oils, but I think try to avoid olive oil, okay, which sometimes, especially on the scalp area, and in our practice, we don't suggest any oils to use, but I think um, some people use butter oil, some other things. It does affect, but I think depending on they can sometimes they more irritation causing. Then we move on to bandages. Okay, now in the past we have wet wraps done in hospital setting. Now we have no facilities to nurse it. But I think you still have bandages on the top of the cream that you can put at night time if child is scratching. Okay, and there's special garments available. In the past, well, sorry, until last year we are prescribing on the but from the NHS. But I think now we've been asked not to prescribe any garments on NHS because of the cost also.
So no further wet wraps, you mean?
No, you can go on YouTube, and there's a if you go to Eczema Sport website, they can give you can use wet traps, but you need to have someone a GP practice nurse can teach you how to do it. If someone expert need to tell how to use it, you need to be have it because it does have two layers, so someone needs to tell you how to do it. If you can do yourself, good enough. But think otherwise, you can do just TB grip on it overnight. That is, or you can have a suit.
So to be grip, moist
No,
to be
sorry,
grip,
no, too big. It's to be fast.
to be fast.
To be
Okay.
fast, which is a to be fast, which is like a to be, but it's a very thin and cotton paste. Okay, you can be applied for it on it. And moving on from these, then you have immunomodulators available, which can some GPs prescribe it, but we use in this one. Just going back to the question we asked about the food allergy. So if you think that your child have a very severe asthma, very severe eczema, and you think and the suspicion of food allergy comes in if they have a very severe eczema, if they have a reaction to the food soon after the taking the food, or they have a gut symptom, for example, they have a diarrhea, if they lose stool, vomiting, these kinds of happens after food, then you can think of change, contact your GP or dietitian. You can go to except hydrolyzed milk, which is less protein in them, which can be used for 4 to 6 weeks for if you have suspicion of a cow milk allergy. We don't advocate to use goat milk and also no soy milk under age of 6 months. Okay, which we come across maybe, and we find a lot of Asian Caribbean shop. They have um, uh, a cream available. Okay, coming from overseas, very good for the eczema, and also Chinese shop. These creams have a lot of steroids, so you may find it get better, but you find these, and also as soon as you stop them, you have rebound effect because that's why try to avoid the cream you buy and the local shops which can sell you as a extreme eczema coming from overseas, and best to avoid them.
So the
And
question here is that how long we should try a treatment before saying it is not working?
of
Any sort of if you're emollient or steroids, how long before we can say we need to move on to next step?
depending on if you have recurrent, it's a flare ups. Okay, if you have a eczema, you put the moisture cream, no flare ups, you okay. You put a steroids cream on. Okay, you put the cream on. Okay, after 1 week, 2 weeks, come back again. It means we need to move on something else because there's we can't use steroid all the time. Okay, you can use steroids for 1 week, 2 weeks, then you taper off slowly, and then afterwards you have to think about immunomodulators, which can be prescribed under above 2 year age, license for over 2 years, not under 2 year olds. So you have to think about different things. And also, I think all the parents ask them to look at the analytical factors. Although maybe they have toys at home, house just might, they have someone have pets in the family, so they may be in contact with pets. They have grass. They may, so in that case we have to think of move on to some other treatments, or some tests to be done, or maybe a history, as we discussed in initial talk. Take a good history from parents, find out which is a trigger factor, whether they go out or they at home, or so think about rule out one by one.
Sure, thank you. I think what we need, I mean, there is a lot, I think we can talk about eczema, but we are running out of time and we have to go on to our next very important subject as well, which is acne. I think this is one of the most common presentation for which uh, most of teens will come and seek help, and it has got implications beyond just the skin problem. So can you tell us what is acne, and what sort of what kind of acne we are talking about in the young patients?
Acne is a chronic inflammation of the sebaceous gland, which is more common on the face, on the chest, on the back area. That's why these are a common place for acne you may come across. It can both age. It can normally start from nowadays. We've seen age from 10 to 13-year-old have on with the onset of puberty. Acne is normally caused by, if you look at the sebaceous gland, it's caused by the sticky dead cell in the lining of the gland, which come together and because of overproduction of keratin. Then what happened? Then you have a oil secreted by a special gland, and we mix up, and then they clog the hair follicle, and form a blockage, and that's going to inflame the acne. Uh, then we have certain factors such like testosterone.
We got a caller. If you give us a chance, we can take a call. Yeah, you carry on.
Okay. Testosterone and DHT are two hormones which contribute to the acne, and they lead the bloodstream and bind with receptors in our gland, and lead to increased secretions and lead to acne. So you may find these are few hormone factors, but there's bigger factors which can risk factors which can lead to acne. So, for example, hormonal is more common across the polycystic ovarian disease, very common, and stress can cause acne. You may find some children uh, who has acne, but they have but they have some people have stress. They try to scratch the face, cause acne. Okay, other question we come across is diet. Whether diet has a role? Although there's no direct link with the diet with the acne, there's an indirect link coming up nowadays. If you have a take high carbohydrates, high sugar, high glycemic index, just like biscuits, chocolates, and which can cause indirectly can cause acne, but there's a direct link with it. And also cosmetics, yes, oil-based cosmetics. So avoid oil-based cosmetics. Sometimes medical problems can cause it. Some medication can cause it. Just like I use anabolic steroids used by teenagers, and also lithium, some pills can cause it. So these are some risk factors for the acne.
So I think somebody was trying to call us on the WhatsApp, and unfortunately, we can't take the calls on WhatsApp. If you wanted to speak with us, you need to ring our studio number, which is 01902 972 150. We can only take your text message on the WhatsApp. I have got your text message which says, "What can one do to help prevent hair loss?" We did talk about before this show that this is perhaps one of the topic of interest. Unfortunately, we are not talking about it today, but we have already planned that this is going to be one of the topics which people want to talk about. I think we perhaps need to park this question for this show, but we will definitely let you know when we will bring that show in which we will talk about hair loss in more detail. If you want to ask any question about eczema or acne, then I think it would be more relevant to this show. Hope you understand. So coming back to our topic today. Can you tell me that obviously this is a skin condition. Nobody like those dots on the face, especially. What kind of effect this has beyond skin?
I think beyond skin, we come across psychosocial aspect. Okay, a lot of teenagers when they have acne, and there's they don't go out. Especially girls, they put a lot of makeup on, and they find difficulty cope. In fact, that's why I think acne is a condition we come across. We need to take it very seriously and start from beginning of the. As my colleagues also GPs asked them to working in the primary care and secondary setting, if they seen acne which is causing psychosocial aspect, they need to have a treatment straight away instead of or it is just missed. Okay, just leave with teenage acne to go itself. That's why this is very important to have a have treatment with these. So coming back, if you have families to acne and your acne coming teenage, and you need to act on quickly because these family history acne they can be severe. In that case, you need a early treatment. It's better for the kids and in the future.
Okay, another question says any specific food that exacerbate acne?
Okay, spicy foods are high. If you look at the, if you might have to go later. High glycemic index food, for example, the sugars, biscuits, chocolates, they can indirectly instead of if I take one chocolate, okay, if I take 10 chocolates a day, I might do have it acne because they increase the sebaceous gland secretions. Okay, it can cause, but others there's no direct link with any particular food which can cause acne.
Are there any particular skin types which are more prone to develop acne? Something to do with pores, something to.
There's no skin type. Okay, Asians and white skin they have a most have a different type of acne. But then Asian skin you tend to have more pigmentation problems after acne, and more scarring is more apparent as compared to. But I think Asians have more scarring, more pigmentation problems with them. Because sometimes you have blackheads and acne can be because sometimes of blackheads and whiteheads and inflammatory acne, which is another type of acne we come across a lot. So you may find in especially in teenagers you have start from the blackhead. So what is a blackhead? We have a dead skin oil, and they occluded in the hair follicles, and they come to near the surface and become on near the top, and this is not a dirt, this is a secretion sitting just near the skin, and sometimes the hair follicles get inflamed at the bottom. That's why you have a whitehead come and becomes a lot of inflammation than a papule or nodule which is thickened block raised skin come up on the skin. So these are different kind of acne, and we need to act on quickly. For if you have think someone has a very nodal acne, they need a treatment, treatment available and from GPs especially.
So, is there an acne? The question is, does the acne leave scars?
It does leave scar. Okay, depending on if you have a acne which affect your part of the spatial gland at the deeper level, it can leave a scar. And so scarring can be different types. I think definitely some acne, if mild one, normally scars go away. About 50% cases, scar go away in 6 months, 12 years time, but 15% cases scar can be whole life. That's why I think acne is very important, especially teenagers. If you act on quickly, you can treat it quickly, better way because a lot of treatment available, and you can treat them adequately, and so that prevent the scarring, prevent the psychosocial aspect which affect the teenagers. Also in women all ages, because you may find in adults and the men because they have more puberty, but women because it's more related to hormones during the period time. They have periods all the time, so they can have more acne persistent over the years time because hormonal changes.
So, I think you have partly touched on that because they asked, does acne happen only in teens? And then the next question is, can we get rid of acne scars?
You can. Okay, now it's again acne scar can be can or cannot be, okay, depending on how deep they are. Okay, so there are some treatment available. You can some laser available, some light available, light therapy. They are available. There are few things on private sector available. Nothing available in NHS. It used to be in the past. We have some laser, ablative laser. Again, you have to go some way which well-known providers for this. It can be, but I think you can't get rid of all of it. Best to, if you have a severe acne, you have scar coming up, you have gone medication, we have discussed Roaccutane, isotretinoin, which is a prime medication for this one. We can get rid of scar with this one in this case.
Thank you. This was the end of our second segment. We are heading towards break. If somebody wants to ask a question from Dr. Feek about any of these topics which we are discussing today, please ring us on our studio number 01902 972 And you guys are already asking us questions, and you can read our WhatsApp text number on the Facebook Live as well. We will be back after this short break, and we will start talking about treatment of the acne in the rest of our program. So please stay tuned, and we will meet after short break. Welcome back. Assalamu alaikum, viewers and listeners. Uh, Today's program, Health Clinic with Dr. Galani, and we are joined here by Dr. Shad Rafiq, who is the special interest in dermatology uh, GP who works locally here. We have covered so far lots of issues around eczema, and now we were talking about acne and types of acne we have discussed. Uh, we will have this segment, which will be 15 minutes before we go for the azan break, and then we will have a very short period of time. So, without wasting any further time, I will go and we will carry on with our uh, topic of treatment of acne. If you want to ask us any question about these topics which we have got today, please feel free to do so. You got our number displayed on the live Facebook feed, and our studio number is 01902 972 and send us any question via WhatsApp text, which is 07 440 420 432. But unfortunately, we can't take any calls on WhatsApp at present. So, coming back to you, Dr. Saab, tell us about the treatment of acne.
We start from the basic treatment, which is generalized. That's most people ask, okay, what I use for washing my face and what other things. So I think first thing, not to pick your acne, because if you pick them, it can cause inflammation and lastly scarring. And now wash the face with any gentle cleanser, okay. And also use, if you want to use makeup or you want to any moisturizer, use non comedogenic. If you look at the reading, so you can find on the non comedogenic moisturizer, which is quite useful. And also the treatment, if you have start treatment, you have to wait for about 6 to 12 weeks before see any improvement, especially taking oral antibiotics. So these are, and also, so we start from the treatment, what we can do. And we have a treatment available over the counter, but there's not, if you have acne coming up on the face, over the counter, only you have benzoyl peroxide, but that's not, that's very small effect only initial phases. But I think either you go to GP, have some ointments, because I will divide the acne into mild, moderate, severe. Okay, in mild acne, you can use creams. Again, creams can or gels can be available from GP, depending on. So if you have a Asian special skin, you need to think about some creams where or gel available where you can use Asian skin. You have less scarring, less pigmentation. So the skin one is one of them which have to, okay. Then you have, if you think you have black heads or white heads, in that case you need retinoids cream, retinoids cream available, which can be used for black heads, white heads. And if you have inflamed, then you have benzoyl oxide along with antibiotics. So normally, if you find if you give a cream to someone, it is how I use it, it causes irritation, redness, or have a reaction. It does mean what you have to you try to use cream once or twice a week first, and try to build up slowly, and use the cream only at night time, and because it has these creams are photosensitive, especially the retinoids. So try to use kind of cream at night time, and try to use only once or twice a week, and build up then a couple of times a week, slowly. And some creams you apply on the face, some just on the spots, depending what type of cream you are using it. Then you come to moderate acne, where you have a big spots coming up and leave scarring. You need to go antibiotics. Again, antibiotics are available in the form of capsules, in the form of tablets. Again, we try to give, ask for, if you go to see GP, ask them to give once a day one, which is better for teenagers. If you ask a teenager to take antibiotic 4 times, twice a day, they never take it, because they go to school, come back home, work, other things, they can't take it.
And is that always in the form of tablets or capsules, or you can have it in creams as well?
Antibiotics in the creams, but in creams as well doesn't work isolation. So we try to have In the past, in 20 years ago, you give, nowadays I think best evidence coming up. You have combination with the benzoyl peroxide or retinoids. It's better to have combination of them. It's better.
So what happens with what is the connection between benzyl peroxide and sun exposure?
But, I think it's more of the retinoids, okay, more, okay, because I have we can photosensitivity, okay,
Okay.
it's make the skin photosensitive with them also.
So the antibiotics are indicated for only infected acne.
No, it can be a mild. I think this one. I think it's more moderate. So you can start if you think that the living scar mark, scar mark, even the mild acne, you start antibiotics. Okay, and start moderate acne, you start antibiotics. So antibiotics, just like tetracycline, they can't be given under the age of 12. They have other antibiotics available. So antibiotics available in the form of capsules and in the form of tablets also. So you can try to have once daily one's better because compliance is better. Okay, and you try to use about before you see an effect, you may see at least a month or so, 6 weeks to 8 weeks, you see any effects on it. Okay, and if you find okay, after 3 months we get better, then you come back worse again. Okay, then come back. You have to uh, start course again. It means it's in that you had to move second, third step, which is isotretinoin. You need a GP, refer to hospital. Isotretinoin treatment, which is 80% acne whole. You have no acne whole life. 20% may come back, and it helps with scarring, and it's magic medications for the for acne. And if someone come, if a child have a acne on the back, on the chest, on the face, okay, and with scarring, they need to go on medication straight away on this one. Okay, in that case, we don't give any oral, but just start on in a setting, start to straight away in medication because we know that it's work. But
So,
isotretinoin has some. Yeah, sorry.
so isotretinoin is obviously a specialist drug,
Yeah.
and primary care usually goes up to the level of giving oral antibiotics, and they will prescribe all the creams, etc.
Yeah.
Do they need to do any investigations before they refer it to the specialist, or is that just all down to the clinical presentation?
For investigation of acne, there's no much investigation of acne needed, except in patients who have polycystic. If you have a people, especially ladies who have acne and they have abdominal hair growth, hirsutism, irregular periods, then you need to rule out the polycystic ovarian disease. In that case, you can have a Dianet or other pill available, okay, another form which can be anti-androgenic, which can helpful in that acne. But again, that's last time for 1 year. You can't use beyond 1 year. In that case, you have to think about other medications because of the risk of clots in the legs and the lungs. And other sometimes we have other condition, genital hyperplasia, which is the condition which can be acne, but they have other problems with them, other symptoms for this, which can be investigated. Otherwise, no treatment needed for acne.
So there are other causes, but they are rare, and they don't
Yeah.
normally come with just the skin
Yeah, they
condition.
come with
They
other
will come
yeah.
with other things as well. So I think you were going to touch on whether the suitability of roaquatan or isotretinoin, what we know known as, because somebody asked the question, is it suitable for everyone? I think you were about to touch on who can take it and what are the demerits of taking it.
Okay, I think before I forget, I want listeners to have a couple of websites. The one is www.bad, B for badbad.org.uk, which is a website. We give you information on acne or discussion about atopic eczema today, also isotretinoin. And
it is not a bad site. It is British Association of Dermatologists.
yeah,
I guess.
British Association Dermatologist website, which is a leaflet we have for the patients. Also, they have leaflet on the isotretinoin, which give you more explanation. And there's a website, Acne Sport, which give you about the myths, what we talk about today, about acne and what's useful, what's not useful, and quite useful for the patients. So going back to isotretinoin, this is a novel medications. Okay, so it can be given any age. Normally we give it's last we give about 13 14 onwards we tend to give nowadays because if the acne very severe and it's only thing with the we need a pregnancy prevention program for it, because you can't get pregnant while these medications, and also about 3 months after medications. But these medications have we do a regular blood test and also pregnancy test every month when the medication is given. Okay, and other side effects, sometimes the liver make a glucose high, and also liver. But these tests, regular tests done and monitor very closely. And recent evidence coming that affect the mood, but that's why every time you see the dermatologist or GP special interest dermatologist or nurses in hospital, they ask these questions. Make sure don't have any side effects. It can be stopped, or dose can be adjusted. And in the past, we used to give 4 months. Now we tend to give a medical system where you give a smaller dose or longer period of time, called cumulative dose now, which is more helpful now, because we found that a high dose, more side effects. With a low dose, less side effects and prolonged period. It is a cumulative dose more effective nowadays, so which is quite helpful for our clients or patients.
Is there any impact on mental health when you are on these tabs?
It does affect the mood, and that's why it is monitored very closely nowadays. A patient already have a depression or anxiety, we tend cautious about it. And these patients, we give them, okay, but you have a cautious. Sometimes we just assess the risk and before start medication. If there's a risk very high, then we don't start medication. Then, okay.
So you mentioned about the liver test and the glucose test. Are the people at risk of developing abnormalities of liver functions and diabetes?
No, I think they can cholesterol high, but it's temporary. As soon as stop medication, levels goes down, and that's why the blood test is needed every time. Increase the dose, or every time you go for any prescription change.
Thank you. The teenager question said, how can you reduce flare-ups and redness on the face, and how you can hide it?
Is it because acne?
Yes.
It's hiding. Okay, you can use a good cleanser. Okay, and for non-condogenic cleanser can be used for it. Okay, and also, and with also sun exposure does help. I think I'm not saying to go to sun. Okay, but I think it does help to short term. Okay, otherwise I think. With time, okay, depending on acne is what, because of maybe it's because of redness, because other condition, maybe rosacea, a possibility there, which presents similar but acne rosacea, and for which you have a different kind of medications or different topical creams available. So we need to look into the real picture, okay, history, what's causing redness, okay, whether because maybe some underlying problems. So it's difficult to say on whether what can be useful for redness.
Is there any role of the camouflage and this kind of?
Camouflage does help. I think again, camouflage. Again, you have to camouflage does help with acne scarring. Other things people use camouflage. For camouflage, if you have acne, you can go to your GP. They can refer to there's a organization called Changing Face, and for only GPs. Can refer to them, okay, or GP or your hospital consultant, and Changing Face give you the online form to fill in, and they contact you. They give you advice on what to use for camouflage creams and powder, and then you can get one NHS. Otherwise, you can go privately, and they can do camouflage. Some people they have or you can buy it. Okay, you do camouflage. I think if you can go to GP, okay, they can. You can go website yourself. Explore called changingface.org.uk. There's also a website for it used to be Red Cross, now changed to a Changing Face, which is another charity run by a charity which give you advice. There's long waiting time for it. Locally, we have used to have in Wolverhampton. They're still in Wolverhampton. Okay, they come every couple of months. One is Shrewsbury, and there's one is in Birmingham.
Thank you. I think if I'm not wrong, you perhaps touched on that. The question is, once treated with isotretinoin, does acne disappear forever? And I thought you said about 80% of the
80%, yeah, but 20% may come back. So what we do in that case, for example, you have a Roaccutane in a year time, and you can on a year 2 years time you can repeat again. Maybe a lower dose, because we don't want a short period of time. We don't go high. Okay, what maybe wait for at least a year, then after start a low dose. Okay, and of an steroid. Some people need more. need more courses. Some people occasionally you have a recurrence even after retinoin, but it's normal medications for the acne.
Thank you. So this session was all about treatment of acne, and we have touched on the normal treatment, starting from the creams and then oral antibiotics, and then we talked about the specialized treatment of isotretinoin. We did discuss that it has got some serious side effects, but it still can be used safely under the supervised monitoring by the specialist. Uh, we are going on the Azan break very shortly. We will come back for a very short session, which we are planning to make interesting by going through some myth busting about acne. That will be the short session, but I will still welcome any questions if you had. So please feel free to ring us on 01902 972 150 or send us a text on 0744 042 0432, and we will meet after this Azan break for a myth busting session before we close this show. So please stay tuned. Assalamu alaikum. Welcome back, viewers. We are back with our health clinic with Dr. Kilani, and we are joined by Dr. Rafiq, who is telling us about eczema and acne. And we are now in the last session of this show. Uh, and we wanted to do a myth busting session. I think we perhaps will be ending the show with that myth busting session. So I will just hand it over to Dr. Rafiq to tell us about the common myths around acne and what is the reality.
It's in my practice over the years. Some patients coming in, especially teenagers, because they use toothpaste. Is toothpaste effective for treatment? Yes, it is because it has an anti-inflammatory effect, okay, antibacterial effect. But long term, it's not because it can cause irritation, skin can scarring, inflammation. So advise not to use it. That's another myth first thing. And whether acne is caused by the poor hygiene or having a dirty face, no, because it can be in a way be poor hygiene if you have a large makeup on the skin which block the hair follicles. It can cause, okay. So cosmetic products which has covered the which has if you look at the buy makeup, make sure don't have any oily moisturizer or which has oil, so that I think it don't block the pores if you already have acne. So that's one thing we come across. And and also go non comedogenic makeup. This question already asked by whether acne should be teenager problems. No, it's not teenager. We've seen a lot of people coming in especially ladies in 30s and 40s coming with acne now. So we have to Roaccutane. So it's no longer okay in adults and boys a possibility there, but not okay. And can we use moisturizer or sunscreens in acne? Okay.
Yeah,
So anything? Sorry.
go on. No, I think it's just about the whether argan oil use prevent acne. Is it true? That's somebody's question, and I think very short answer before we finish our show.
Sorry.
Is
Organ.
the argan oil use prevent acne?
I don't know. I know tea tree oil. It has anti-inflammatory effect. Okay, but
But argan oil is very, very sort of popular in new makeups, I guess. So every makeup is argan oil based makeup. So I think that is one of the myths, perhaps.
okay. Oil based. I think Tide oil is oil based. But I think again, tea tree oil is better. It's anti-inflammatory. I think problem with tea tree oil is again if you use it excessively, it can cause block the pores and cause make acne worse. So I think these are okay. They help. I think okay, you can have a tea tree oil to wash the skin, but again, it just I know, but I don't know. Sorry for that.
No, that's absolutely fine. And I think that we will conclude our show here. That was very educational for me as well, and hopefully for our listeners. I think what we would do is that next couple of shows, one of them is going to be about the post-COVID complications, because next health clinic is on 26th of June, and then thereafter it will be on 10th of July. So one of them is going to be about the post-COVID complication, and the other one where we will ask Dr. Rafiq to come back again and tell us about uh, pigmented skin lesions, as well as a very popular topic of hair loss. And we will call him back to enlighten us about those two topics. Once again, thank you very much
Thank you for
for your
inviting
time.
me. Hopefully, I think we discuss the next show hair loss and pigmentation, which is very common among our communities.
Yes, absolutely. So I think with this note, I would like to finish this show. I hope you would have liked the contents. If you have any feedback, please do so. You can still watch the video on Facebook Live at your leisure, and we will bring the next health clinic on 26th of June. Till that time, look after yourself, your older ones, your loved ones, people around you, and stay safe in this COVID. And we will see you again, inshallah. Take care. Assalamu alaikum wa rahmatullahi wa barakatuh.